Welcome to UMHC Take 2. Hi, I'm Dr. Lawrence Haber, a pediatric orthopedic surgeon with University of Mississippi Healthcare. We're going to take a look at spine stapling, an alternative to the traditional bracing used in treating young patients with scoliosis or curvature of the spine. There are several kinds of scoliosis. The most common type is idiopathic or genetic. This usually begins between 9 and 14 years of age, although in some cases it can start earlier. The twisting of the spine and the child's rib cage begins subtly and develops over time. Many times this is noticed during a physical exam, or a parent may notice an asymmetric waistline or rib deformity when their child is in a swimsuit or a dress. Traditional treatment was to stabilize the curve with a brace. Today, through a technique we call spine stapling, we hope not only to stabilize the curve, but to improve the curvature. Here we are in Batson's operating room, where we perform the stapling surgery. Stapling is a more aggressive treatment than traditional bracing and is less invasive than traditional surgery called fusion, which places permanent metal rods on either side of the spine. Stapling allows for much more range of motion and actually helps the body to correct itself. By stapling one side, the other side of the spine can continue to grow and prevent the curve from getting worse, or in many cases improve the curve, by harnessing the body's growth to straighten out the spine. Likely candidates are anywhere from 9 to 13 years of age. The curve is typically more than 25 degrees and less than 40 degrees, and the child must have significant growth remaining. To perform the stapling technique, the patient is brought into the operating room and given a general anesthesia. They are placed on their side. We actually deflate one of the lungs to create a clear space in which to work. There are 3 or 4 incisions, usually smaller than an inch, made on the side of the rib cage. One is for the video camera or scope, one is for tools to assist us, and the other is for inserting the staples. High-tech memory alloy staples made of nitinol, a temperature-sensitive substance, are kept on ice to keep them open. In the meantime, a small stud or template is tapped over the area where the staple will go to give us a footprint to follow. Once the staple is in place, it adjusts to the temperature inside the body, causing the nitinol to contract. We have approximately 45 seconds to get each staple in place before that happens. Depending on the number of staples needed, the surgery takes about 1.5 to 2 hours. The stitches are placed under the skin, and the patient is kept for 2 to 3 days for observation. Activity is limited for about 6 weeks after surgery. Then kids can go back to all their activities, even sports. This remarkable procedure can allow a child to live a normal life. I'm Dr. Lawrence Haber. Thanks for watching. You can watch more medical procedures on UMHC Take 2 at umhc.com.